How's Your Health is like a Swiss Army knife. It's a family of tools that work well together, and the more you use them, the better you get at using them. How's Your Health tools are designed to improve practice confidence and improving patient confidence with self-management, and the tools interrelate with each other very well. All the tools are designed to build on the need of patients and the demands of practice. By using a technology, both needs and demands are met, and the output is useful both for the patient, immediate information for their needs, and for the practice, immediate information for its needs and enhanced efficiency. All the tools build on behavioral concepts that are pretty straightforward and well accepted and related to the individual as well as interacting tools. Ultimately, they all build toward confidence. The patient doesn't have to be bribed to complete How's Your Health because there's something in it for them immediately. Here, for example, is a letter summarizing their results tailored to their needs, and also readings that are tailored to their needs as well. They can go back to the readings at any time. They do not have to sign in and recomplete a survey to do so. They also receive a comparison of the condition management they have to benchmarks that patients with specific conditions have. And finally, if they choose, they can create a personal, portable health record that can go in between practices and is automatically filled out as they complete the survey. This then cuts down a lot of the loss of information when there are transitions of care, and it can be updated at any time, again, without having to complete a survey. So how does this all fit together? Basically, the most important point is the patient or a member of a community, the population at large, has to be invited to complete the survey. In practices, this is best done by asking patients to complete it about 2 weeks before a scheduled face-to-face office visit. The completion rates are very high when patients are asked in this way. We do not recommend that it be completed in the office at all. When patients do it at home, this gives them time because they receive their information and can respond to it and think about it before the office visit. It prepares them. And of course, they can at any time opt to store their personal health record locally so they can carry it around with them, or in the near future in a storage vault provided by How's Your Health. Practices and communities can immediately customize the survey by adding subgroups such as different doctors, questions, open-ended questions, activating different forms of standard national surveys such as CAHPS, and offering a pre-visit review of systems for the patients. This is done in the customization options. The practices immediately get something out of How's Your Health, but to get it, they have to customize it. That is, otherwise the patient has to bring it to the practice. But if the practice customizes How's Your Health so that the patients can email it, the action form as shown here is sent immediately to the clinician. And a registry, a HIPAA secure registry, is built for all patients so that the practice can sort patients in behaviorally sophisticated categories, totally unavailable by typical registries that are oriented only by disease. Here you can look at your patients, for example, who lack confidence, or have diabetes and lack confidence, or poor financial status, etc. How to do this? You merely have to set up in your customization an opportunity for patients to be offered the chance to move from being totally anonymous to identifying themselves so that the registry can store information about them. Best time to call, their name, address, their email address, etc. So, how do you do this? You merely, in your customization options, set up a spot to email the action form, and you can then, at any time later, go in and get the patients from the registry just by choosing this option for patient report. It's that simple. Finally, it's important to emphasize that even if your patients remain anonymous and choose not to email you their results, their totally anonymous information can be forwarded to the practice through the anonymous summary survey, and the practices can use that information to help improve practice in general. How to look at your results? You merely go to choose your summary, request all items and the practice quality results, and immediately you'll see how your practice is doing for all patients and those who have income problems in accepted domains for medical care and desirable consequences of care. In addition to the global measures as just shown, you can, for each individual measure, drill down to look at how your patients are doing on all types of measures of quality. In summary, How's Your Health has a lot of tools that are designed to help patients and members of the population across many phases of their lives. Staying healthy, getting better, dealing with chronic illness, etc. Here is a list of the tools available at this time. And here, for example, is a different registry, the hospital registry. Again, showing us that all tools have some commonalities, whether you're using the outpatient version, the frail version, or the hospital version. And this slide, based on current work, shows a way in which tools are often combined to improve transitions of care. Not described here in depth is how to put this into a practice. Suffice it to say there's a technology support approach, practice change support, and we strongly recommend involvement of patient volunteers to help implement the technology. You will learn about this approach in greater depth on the How's Your Health website. In summary, regardless of the jargon you use to describe what the future of care should be, whether it should be focused on triple aims or medical homes or accountable care organizations, How's Your Health is a wonderful set of tools for embracing patient experience, population health, quality improvement, and to a more limited degree, helping you focus on cost. In sum, How's Your Health is like a family of tools built into a Swiss Army knife. They each support each other, and you will get much better at their use over time.